No, yeah, yeah, absolutely. All right. Well, good morning to everyone that's here, and good morning to everyone that's online. And we're also gonna record this so we can post this some different places so people will have access to this information. We're here live at Alton Waters here with Russell for their Bread Guilt and Bread South sale they're going to have here in a little bit later today. And Russell asked me to come out and to be able to do a presentation on herd health, and so that's what we're going to do today. So. Hopefully this will all work. Oh, back up. jumped on me. Okay, so a little outline what we're going to do, just a little foreign disease update. We won't do a lot on that. That's more just to where the industry's at and what they're trying to do to prepare for foreign disease. Then we're going to go through some common diseases, clinical signs, vaccine strategies through the presentation. Kind of cover about everything, respiratory, systemic, enteric. Little update on PED, vaccine program layout, so just a very general protocol on what we recommend, the major vaccines. Not only are we going to cover if you have sows and you're farrowing, but also we're going to cover for people that just buy pigs. So what boosters should you use, why, what timing, all that kind of stuff. And then just what are the most common phone calls that I get every day. And so we'll kind of go through that as we go through. So foreign animal disease, the big deal in foreign animal diseases is why it's tough sometimes is because some of the clinical signs are very similar to what we see in the industry. And so just like here recently, we were just talking about it behind, is just the recent break of finding some Seneca Valley virus out of a few shows this summer and fall, and going home and people seeing clinical signs. And so the problem with that is, even though Seneca Valley is a common found thing not only in the show pig but also in the commercial industry, its clinical signs are very similar to some foreign animal disease, like foot and mouth disease. So we've got to treat those as is. It could be a foreign animal disease break. So that's why proper testing, all that kind of stuff's got to do. Disease onset's very similar. A lot of these things kind of get in on garbage feeding. So like African swine fever, a lot of those breaks that have been getting into other countries is because of contaminated meat, and then it gets fed to swine, and that's how it gets into the population. Recent animal introductions, consumption of foreign food stuffs by employees. So that's why, like a lot of commercial farms I work with, it's illegal or not illegal. We don't allow any workers that bring food into the farm. All the food has to stay in the break room area, and nothing can go back into the farm. So it just reduces risk, just in case there is something contaminated, so it doesn't make its way into the pigs. Again, like I talked about, the Seneca Valley blisters, vesicles, a lot of the foreign animal diseases we see have that, and a lot of them don't respond to treatment. So what tools are available? And I'll try to make this brief so we can get on to some diseases. So these are the three major things that the U.S. pork industry is currently trying to do right now to help get ready if there ever was a food animal or a foreign animal disease break. The goal is for us to get back to continuity of business as fast as possible. And so if all these things are in place, what allows the U.S. swine industry to get back to selling meat overseas or products overseas? Because the minute that we find out there's a foreign animal disease, all foreign trade will be shut down until we can prove that we have the traceability and be able to track where those animals are in the country, that we are providing meat overseas that is not contaminated, especially, I mean, the main goal right now is ASF. So AgView is just, it is a platform that will show a little more detail, and it's all about traceability. And so it's like us for shows that doing a health paper. The main goal of a health paper is, one, the vet to look at and make sure they're healthy going to the show. But the other huge opportunity there is if there is a break at a show, that's what the people doing the investigation, everything, is going to use to be able to trace where all the animals went throughout the country, or where did they originally come from. So AgView is an online platform to be able to do that. Secure Pork Supply is the piece that allows that continue of business. So this is proving, so if there is a break and then they do the radius around where it's a control area and everything, if you have the secure pork supply in place, which a lot of the commercial industry does, very limited in the show pig industry so far, this will allow you to start moving animals out of that quarantine area on a regular basis, because you have all these biosecurity things in place already, and you're able to report movements. You have everything in place. U.S. Ship is a pilot project, and it is moving to be a USDA actually funded opportunity that basically it kind of ties all these things into one program, and it's probably more for commercial because of the foreign trade, but it's an opportunity for the entire swine industry to really be able to have the right things in place to be able to get back to continuation of business, or to be able to continue to have livestock shows or swine shows. And again, I'll get into details in just a second, a little more. So AgView, basically, so what it does is you're able to see like every movement that your pigs make. And so like if I were to go to a show, and I see real opportunity here, and I talk about it at different places, but I don't know if it'll ever get a hold, but be able to use this and maybe instead of like the health papers, because this would allow us to track movements from like me and my family leave, we go to a show. We go to a show, I enter all our information, all my pigs' information, the 840 tags into AgView, and then we move those pigs to the exposition, which will be in Des Moines, Iowa this next spring. And then if animals there, okay, I sell 2 of those, I enter those to go to this new location, or I return them home. And so it's just an online to be able to, AgView is all about traceability. So this hasn't, we talked about this at one time, maybe putting this into place, but that has not come to fruition yet on trying that with some of the trailer spaces. Secure pork supply, and so this is the actual program where you get approved. So it allows you to move animals out of that quarantine zone faster. And implement enhanced biosecurity. So this is creating like a map of your facility, borders, all that kind of stuff. Premise ID. You're able to conduct, so you prove that you can do surveillance sampling if you need to, and then you have the movement records like a program like AgView. They will allow anything. You don't have to use AgView, but it is one of the opportunities. Certified swine sample collector, and so this is, each state's a little different, but this is where a veterinarian can train someone on site. So I can train my commercial producers to be able to, if there is a foreign animal disease break, veterinarians, the USDA is going to be very, very busy. This will allow a trained individual on that farm to take the samples and submit them if they need to, if for some reason the veterinarian can't get there. So how it all ties together, basically you've got your certified sampler, which is your sampling and testing. You've got AgView, which is your traceability, so be able to trace animals. Your biosecurity, which is your secure pork supply, and all that is what ties in to the U.S. SHIP. U.S. SHIP was based on the poultry industries, had this for, I don't know how many, 20-some years, and so they base that a lot because that program's been very, very successful. So like I said, that was a pilot project. It is in front of the USDA to get approved and actually become a USDA-funded project. Keep bumping. So the U.S. SHIP, it enhances all 3 aspects, like prevention, response, and recovery of trade impacting diseases primaris amongst participating producers, slaughter facilities, and states through proactively establishing an industry-informed and working system of operations and certification built upon well-defined program requirements of those 3 things. And basically what it does is reduce the impact of recurring endemic diseases. So if we do get that, it allows us to get back to business faster is the goal. Reminder, health papers, health papers, health papers. Anytime animals that are transferred across state lines, health papers are in place like I talked about earlier. They should be done because that allows us, if there is a break, that is the only thing that we have that most people are using right now to be able to trace those animals and where they come from. Okay, so let's get into a little more actual disease. So testing. So I talked to a lot of clients on the phone. I'm like, I want you to get these samples. I want to get these samples. This is a little more of why and what diseases each one of these samples that we can test for. So processing fluids came out a few years ago. So basically, it's a little tougher in the show pig thing right now because no one cuts their boars anymore. They sell them as boars. It's a buyer's responsibility to get them cut. So it's a little tougher in the show pig thing to do processing fluids unless you are cutting your pigs on the sow, or at least some of them. So what you do is when you're castrating, we just throw all the testicles in a big Ziploc bag throughout that day, and then what we do is we just pour off the fluid. And so what that fluid is, it's serum. It's the same thing as bleeding every one of those pigs, but we get an entire sample of all the pigs that were castrated that day in one sample, And the nice thing is we can run PCR on PRRS, PCV2, PCV3. Those are the main 3 that we're doing right now, but it is a very quick, easy way to collect a sample to say, because typically if there's PRRS within a herd or there's a problem with one of the circoviruses, it's going to be in the baby pigs that were just born. And so we're able to test all those pigs, one sample, say, yes, your pigs are all being born PRRS negative, or no, you're having some pigs being born PRRS positive. One thing important on that is needs to happen prior to being obviously vaccinated with a modified live vaccine that might give us a false positive. Oral fluids, that is one that like nursery pigs, it's a little harder in Fahrenhouse, but it can be done. Hang a cotton rope in the pens, and those pigs will chew on it 15, 20, 30 minutes. And what that does is it gets a whole population test of saliva. And so what we do is that cotton ropes drenched in saliva, we wring it out into a Ziploc bag. We pour that into a test tube, send that off. So anything that gets exposed to the pig's mouth, so not only anything systemic like PRRS or flu that's being shed up through the nasal passage, mycoplasma that's being coughed up from the lung, but we can also test for PD, delta corona, TG, and ileitis, which are enteric diseases, but also if it's in the environment, they're getting their mouth contaminated too, and so they get it onto the rope. And so that is we use this a pile in the commercial industry for testing just what is in this barn. In a finishing barn that has a cough, we can run it and run all 3 of these things. Or this barn has diarrhea, we can grab oral fluids and test for any one of those. So again, it's a very population type thing. Blood, more individual, so we got to test every single animal, but again, it's kind of the same thing as the oral fluids. PCR, we can do PRRS, PCV, PCV3. ELISA, so PCR, a little more backup on that. PCR is if the actual virus is there. So it's looking for genetic material of the virus, of the bacteria, where ELISA is testing for antibodies. You can also do some antibodies on oral fluids. It's not as consistent. You can do ELISA testing, but ELISA is actually, has this animal ever seen this disease? It doesn't mean that they're exposed right now or they're shedding virus, but it just means they've seen that disease at some point in their life, and so they have antibodies to that disease, and so we can do that. You will see that, like blood, we can't test for flu PCR because flu doesn't go systemic. It sits in the lungs, it gets coughed up, versus some other viruses that go systemic, get in the blood, get in the tissues. Tissues, one that I struggle a little more to get this done in the show pig industry at times because everyone's pig is high value, and we get that, and it's really hard to say, okay, I want to necropsy, euthanize this animal, or I want to do this one because it does take euthanasia or a very acute death that we can get to fairly recent to before the body starts to decompose. And I get it's a little more harder to convince people to do this, but the reason that I push so hard on getting real samples versus just some of the blood is the biggest thing is this histology right here. Is so when we pull samples out of that animal, not only can I run PCR like I can some of these things up here, but I'll take very small pieces of that tissue that might be infected and put in formalin, and then I send that to the lab. And what that allows is they can take very thin sections of that organ, of the lung, of the liver, the kidney, the heart, and look at it under a microscope, and they can actually look for the disease process. And so they can reconfirm, okay, we found PRRS by PCR in the lung, but is there lesions in the lung that go along with PRRS? So it really helps us say, okay, yeah, we found all this, but here's the actual lesions of the disease. Yes, that is what's going on. Or we grew E. coli in the intestine. Okay, under the microscope, a piece of the small intestine, we actually see bacteria that's attached to the lining of the intestine, and that's and then that just helps confirm. So that's the big reason we try to push. Not only is it hard sometimes with culture too, we really need pieces of the organ and everything to try to grow it. So yeah, that's the goal on that. That's why if you ever talk to me, we're trying to get samples of tissues. That's the big reason. So we can actually confirm what the disease process is going on. Okay, a little more, we'll dive into some more specifics. Respiratory disease here. So different clinical signs. Do you see a few pigs coughing? Is it a deep cough, labored breathing, or thumping? or are they dog sitting, which is a little more, so the pig's actually sitting down on its butt or on its back haunches with its head in the air, open mouth breathing. That means that the animal's lungs are so bad, they've got so much fluid, they're trying to let the fluid drain to the back of their lungs to be able to get air. And we definitely see that sometime in severe, we'll just skip videos because I'm not sure how well they'll work. So causes of respiratory issues. So a lot this time of year, the weather's changing. A lot of barns may be okay. There's not as much ventilation in the barn because you're trying to keep heat in. Ammonia levels come up. A lot of this time of the year, humidity's changing, less humidity in certain parts of the country. And so is it just an irritant of the line of lungs, so they just cough a little bit here and there? Is it a bacterial cause of Pastorella, Bordetella, Parasuis, Asuis, Strep Suis? There's lots of different ones. Mycoplasma, we'll dive into a little bit more here later. Or is it an actual virus? Is it PRRS or is it flu? Or one that we do see sometimes is actual parasite migration, which we'll talk about a little bit later. So lots of different things that can cause a cough in a pig. So viral versus bacterial. Viral, so PRRS, flu, circovirus, they cause more interstitial pneumonias. And bacteria cause more, they're more internal. And so you'll see more local lesions. So hopefully on video you can see this. Lung A, that is a perfect lung. You can see it's very white, it's very spongy, it's very tough. B, you can see where most of the rear lung, so this is towards the head, and these are the lobes that hang down towards the lower part. And so you can see how some of this bacteria is settled. As soon as it comes into the trachea, it settles in the front port of that lung. And so it's actually consolidated. So this is a pretty classic, and so is this one here. That's pretty classic mycoplasma. And so that mycoplasma settles in the very front. And so then, and that's completely consolidated and smashed, or not smashed, but it doesn't get any air into it. So we wonder sometimes when we're out, let's do this. Okay. And so we wonder sometimes after a pig gets sick, and I'll show you some more severe lungs in a minute, why these animals never recover, why they never get 100%, or why they go out. They used to drive for 20 minutes, and now they only drive for 10 minutes before they start gasping for air, or they start just getting stressed out. Is because of that, because those lungs are destroyed. This one might be a little hard to see in video. This is a very shiny lung. This is what's interstitial pneumonia, so it looks very wet and heavy. That is what PRRS, flu, and those type of things can do to a lung. So you wonder why sometimes pigs get PRRS or flu, or why they sit there and thump, is because they're trying to get air into that lung. So managing respiratory illness, why do we get, before our lungs get that severe? So must get on top of clinical signs quickly. So you start seeing a pig cough, or they're off feed, or they're thumping a little bit, we can't wait 2 or 3 days to start treating, because that disease process just sets in more and more and more. The faster we can get on them with not only antibiotics, but also some other medications, it helps their lungs prevent from getting as much inflammation and scar tissue. We really want to prevent fibrin buildup with some other bacteria, which we'll show in a minute. Get back on feed to prevent also. The longer a pig's off feed, the more chance of an ulcering. And a lot of times I talk about people is it's the pig's immune system, especially with PRRS and flu and those with the viruses. It's the body actually fighting against the virus that causes so much damage to the lung at times. So what we do, I didn't save it, but antibiotic, so whatever antibiotic is best to be used for whatever we think is going on, especially, bacterial. If it's viral, we use an antibiotic a lot. If we think it's PRRS or flu, just to help prevent secondary infection by a bacteria. Banamine to help with a fever, inflammation. Dexamethasone makes them feel better. It helps open up their lung. The other thing that we're using a lot at this time is a cattle-approved drug. It's not approved in pigs, but we are allowed to use it. Off-label is Recover. It's an antihistamine. What it really, really does is we like, especially, and the only time we really use it is pneumonia pigs. So it's what really opens the lung back up. It prevents as much damage to be able being done to that lung while the animal's sick. And we've seen a lot of benefit. So again, that's a product called Recover. So this actual specific respiratory diseases. So again, this is a lung. This is pretty classic viral. You can just see compared to our white spongy lung how wet and heavy it is. It's shiny. You can actually see like down in here in these gaps, it looks like it's expanded with fluid. That is interstitial pneumonia. So it's within the cells, it's within the tissue, and just it's a lot of edema and swelling. So flu, this is the one you walk out, you walk into your barn and you hear the really deep croup. A lot of time that's flu. It moves pretty quickly through a barn. It's very, very contagious. This is the one we also see a lot at shows. This is why a lot of shows recommend for them to be vaccinated with flu, is just to help have some immunity before coming. Like in people, flu vaccines are not 100% effective. They're not going to 100% prevent pigs from getting sick, and I'll kind of show you why here in a second. It's like in people, we're always trying to update those vaccines, the autogenous vaccines, but it does lessen the severity of the disease and lessens the amount of virus those pigs are going to shed while they're sick, and they'll recover a lot faster. So it's just like in people. It won't prevent you from getting sick, but you'll recover a lot faster, and hopefully the symptoms won't be as bad. So flu vaccines options, there's really only one commercial vaccine available for flu in pigs. Majority of the flu vaccines that are being used, that's only one now. One of them got taken off the market. But the reason why is we struggle with commercial vaccines is because it was updated in 2011, then it was updated in 2016. It might have been updated again since then. But look how many different flus we have. We have H1N1s that have multiple different segments. We have H3N2 with different segments. We have H1N2 with different lineages and everything. And so it's really hard for the commercial industry that have to have FDA-approved products to be able to stay on top of what the most common ones are. So that's when our autogenous vaccines come into place that we're able to use. They're multi-isolate, and we're able to update these. Like our forced vaccine, we update every 6 months. If not more often, of what the most common flus that we're seeing out there to try to do the best job we can. It's not perfect. I just had a case in Michigan, a commercial farm. They're using, they have a 2-dose flu program at weaning and then late nursery, and we're using 2 different companies' vaccines to try to get the best coverage we can. And they got a new flu in, and just by chance, it didn't cover. Either one of the vaccines didn't cover our new strain. And so we're looking at right now sending those isolates off to be able to update the vaccine to get the most common. So it's always kind of moving target. Again, it's sure better than not doing them at all, especially when we're going into jackpot and show season just to try to boost those animals to help protect them the best we can. PRRS, a lot of time PRRS, we won't see them cough. These are the ones that kind of go backwards pretty fast. They get really fuzzy. They don't want to eat. They don't want to grow. They don't want to perform. They don't really respond to very much treatment. Flu typically is that 2 to 3 days. They crash. They're really, really sick. And then, like people, they bounce back pretty fast once they start to get over it. When PRRS gets really, really bad is when it's in combination with something else, when it's in combination of flu or a secondary bacteria. And this is where we really try to use a steroid like dexamethasone and antihistamine like Recover to really try to help the lungs not be as severe and let them kind of work through the virus and get over it. So different vaccine options that we have available in the swine industry right now are modified lives. So the goal of modified live, for it to work its best, is for you to get the modified live in the pig before they're actually seeing the virus. If a pig already has PRRS, a modified live's not going to do a lot of good because the body is already building immune system to that live PRRS, and so that modified live doesn't do a lot of good. So that's why we move our timing on our modified live PRRS around some. Sometimes we'll vaccinate at 7 to 10 days. Sometimes we vaccinate them at weaning. It's just dependent, farm dependent. But it does build a very strong, long-lasting immunity. Like I said, better if animal has not been exposed yet. And very different than what people naturally think. I get a lot of phone calls when I tell people to go vaccinate their herd with a modified live. These are probably one of the more smoother vaccines we have on sows, even when they're bred. Baby pigs, we really don't see much issues. they're actually a lot smoother than some of our killed vaccines, just because the killed vaccines have so much adjuvant in them, which is what really stimulates immunity. That's where we see some reactions or knock them off feed for 24 hours. Typically, modified lives are very, very quick. So different options, different sizes. The one problem with this is a lot of these vaccines aren't tailored to the show pig industry, and so our dose sizes are pretty decent size, and so we struggle to, sometimes we waste some vaccine because it's got to be used within a couple hours of mixture. Killed autogenous vaccines is just like what we talked about with flu. It's multi-isolate. We've got different strains in there, what the most common ones are that we're currently seeing, and so that one will be updated. But this is where it's good if the farm's already positive, or that pig's already positive. It will help decrease how long that animal is sick and help them shut down on how long they're actively shedding PRRS. And so, like when I have a commercial sow farm break with PRRS, once we know the entire herd is exposed, that's the first thing we'll do is we'll go in and vaccinate with a killed autogenous vaccine. We'll get that PRRS out, we'll sequence it, and then we'll find the best killed PRRS vaccine that matches it the closest, and we'll go in and blanket that entire sow farm, and then 2 or 3 weeks later, we'll do it again. That will really help shut down that farm. It brings all those sows up to a very even playing field, and so we don't just have pockets of PRRS moving around. It really boosts immunity across the entire herd. That way, we can get it moved out of there faster, get back to production, and get pigs moving out the door. So PRRS debate, I've kind of came off this a little bit. I think in the show pig world, I think about every farm should be vaccinating with a modified live PRRS routinely just to keep that. There's a lot of farms that aren't good enough biosecurity-wise, and even if you are good biosecurity-wise, I still see a lot of just PRRS breaks. Some of the best biosecurity farms in the country on the commercial side still break with PRRS. And so the show pig farms, I'm getting more where we just keep that sow farm vaccinated once or twice a year with a modified live, just to keep that immunity as high as possible. So when a PRRS does move in, there's immunity there. Yes, you're still going to have some problems, but you're going to be able to move through it faster. One that also I've kind of moved to, there's some guys that aren't maybe vaccinating sows because they've been able to maintain that their show pig farm is PRRS negative, and they're doing a really good job. They're not bringing gilts in and out. If they do a really good job testing those gilts before they bring them back in the farm. Are you getting a lot of phone calls? And so some of the biggest people, the people that have the most problems when they sell their pigs, and people call back and say, my pigs are crashing, they got mixed, because not today's world, we don't. Back when I was in 4-H in the 90s, everyone would go, when we had 200 sows selling pigs and everything, a family would come to us and they'd buy all their pigs from one place. And so it's all the same health, all the same thing. Well, that's completely opposite nowadays. Everything, you're buying a pig here, a pig there. You might buy 80% of your pigs at one place, but then you buy 2 pigs from someone else. Well, the people that have the most problems is the pigs that are the cleanest leaving the farm. So the cleanest sow farms are the ones that go out, they've never seen much parasuis or strep or seen PRRS, and then they get commingled with pigs from dirtier farms, and then they're the ones that they'll crash and burn and really have a lot of problems. So again, all PRRS decisions should be between you and your veterinarian, but so yeah, that's some discussion on that. So mycoplasma, another respiratory thing. So the big topic here that a lot of people don't know is there's different mycoplasmas. And the only one that has a commercially available mycoplasma vaccine right now is high pneumonia. So high pneumonia is the one that we talked about earlier, that the lobes in the lung, it settles down that lung. And this is the one you walk into the barn after they're 150, 200 pounds, and then they have a light cough. They get up, they cough a few times. Maybe they don't have quite as much endurance to the lungs, getting air when you're out exercising. That is high pneumonia. We'll talk a little bit more about that in the vaccine thing. But it really sets up for then secondary bacteria to hit too. But there are two other mycoplasmas that, because I get phone calls and say, well, I've got junky eyes, or I think I've got mycoplasma in the joints, but I vaccinated when they were younger for mycoplasma. Well, no, you vaccinated for high pneumonia. You did not vaccinate for high rhinus or high synoviae. So high rhinus we see a lot more when they're little pigs. nursery age, up to 100 pounds. And it's the one that really goes systemic. So high pneumonia only goes in the lungs. High goes more systemic. So a lot of the eyes that we swab when they get this junky eye, the swelling, the conjunctivitis, we'll find Mycoplasma hyarinus a lot, almost pretty consistently. And they find that in the commercial world as well, pretty consistently. Red eyes, no commercial vaccine available. But it'll also not only cause the eyes, but it's one of the 3 bacteria I'll talk about here in a little bit, is that can cause the fibrin in around the body, around the lungs and the abdomen, but also can get into the joints as well. Now, Hyacinophiae, it only goes to the joints. And so it's the one that you're 200 pounds plus. Not always. There's other things that can cause it too. Lameness, maybe a late strep, something like that. But 200 pounds plus, and all of a sudden they're starting getting tender in their rear joints, in their hocks. They're starting to get some arthritis, some swelling. We'll find Hyacinophiae quite a bit. Again, there's no commercial vaccine. Has to be autogenous vaccine to be able to use. Again, that one will not go systemic. So you've got only lung with high pneumonia, which makes sense in name. Hyarinus that kind of goes everywhere. Hyacinophiae that only goes in the joints later in life. So that's a big key that a lot of people get confused on, is there is 3 different mycoplasmas that we deal with in pigs. Bacterial causes of respiratory, so Pastorella. We usually find Pastorella in today's world in conjunction with something else. We find it a lot with flu. We find it a lot with PRRS, mainly because the lung is compromised because of those other things. Mycoplasma, something else that's caused damage to the lung where it's more susceptible, then we'll start seeing, we'll find some Pastorella as well. I think we are starting to see more, not necessarily the old rhinitis like we see in the twisted snouts like we used to, but 5, 6, 7 years ago, it's probably been longer than that, we used to have all our feeds, we had antibiotics in them because there was no regulation, no VFDs, that kind of stuff, and we were really able to keep that under control better, that Pastorella and Bordetella, because everything had CTC in it all the time, and so I think it's really crept back up on us. These are the pigs that you get up and all of a sudden their lungs seem fine, but their nose seems full all the time. There's damage. It causes damage in the nose. And so we're pushing more people to vaccinate for the old rhinitis vaccine, Bordetella and Pastorella, just to help prevent that. Vaccine options as well on that. So this is where, these are the ones where we get really, really severe pneumonia. Very, very quick, acute sudden death. These are the ones you walk in your barn and that morning and they are laying there thumping. They won't get up. They're extremely sick and they're dead within 4 or 5 hours. Or by the next morning, no matter what you treated them with or what you did. Because these APP, ASUS, even the streps can do it. The Mycoplasma hyarinus, some of those. This is what a lung looks like within just 4 or 5 hours of breaking with APP or ASUS. It is such a fast acting and produces so much toxin that it just absolutely destroys the lung. And you cut this lung open and it's very hemorrhagic, it has pus in it. It grows really fast and just destroys that lung. So basically that animal, these are the ones you'll see dogs sitting down with their head in the air trying to get air. Necropsy, very necrotic. Time to treat is a very short window. This is why I talk about when you find pigs, you need to get antibiotics and Dex and Banamine and those type of things immediately. You can't wait a few hours to get these animals treated. You got to get on them right away. So a little more, we're going to talk about systemic diseases, so more what goes systemic. Circovirus. The good thing about circovirus vaccines is they are one of the most consistent vaccines we have. They're the most effective. If done right, and the pigs are coming out of a stall farm that are fairly stable, circovirus vaccines are almost 100% effective. And so what you'll see in circovirus vaccines, not only can you see some skin lesions like the purple dots, you'll see kind of purple up between their hams. You can also see some repro problems, but that classic one is wasting syndrome. So these pigs they'll continue to eat. You can see a normal pig here, same age pigs. where their belly stays full to eat, but they just waste away. They get skinny, their backbone starts showing no matter what you treat them with because it's virus. What it does is it destroys the lymph nodes. And so this is one of those diseases that we absolutely want to grab tissues on. Going back to that is I can test lots of different pigs in the United States, commercial show pig, and I'll find circovirus. It doesn't mean that it's causing disease, though. A lot of pigs, if I do PCR, I'll find circovirus. To actually know if circovirus is a common problem, we've got to look at that tissue, look at lymph nodes, and look at lymphoid depletion. So it destroys the lymph nodes, and then it doesn't have any immune system. But again, very effective. One thing that's very important when vaccinating sows for circovirus is circovirus vaccines in sows cause a very, very high immunity response. So we want to always vaccinate sows prior to breeding. So we booster that immunity, but over time during that pregnancy, that immune response is waning. Because if you vaccinate during gestation or too close to farrowing, the immunity is so high it produces a lot of maternal antibodies. And those baby pigs are born with those maternal antibodies and get it in the colostrum. And then that immunity is so high in the little pigs that we can actually block the vaccine that we give the little pigs at weaning. And then the vaccine won't stimulate immune response, and then they can break with circovirus later in life. And so whenever we're using circovirus vaccines in a sow herd, we always want to use it when the sows are open prior to breeding and not do it while they're pregnant. I think it skipped. There are 2 different circoviruses now, and within PCV2, there's 4 different circoviruses now. So there's A, B, C, and D. But also PCV3s kind of came into the thing. PCV2 is the very classic science we talked about a minute ago. PCV3, really, I don't see, most of the time we look for PCV3 is in the processing fluids that we talked about earlier. I really don't worry about it until it gets in that 20s CT count. So a 35 or 36 is negative. Till we get down in the 20s, which means a lot of virus. It can cause some basically reproductive issues. And in pigs, little pigs can cause some problems in the Fahrenhouse, just want to be weak-born, not as good. So anytime we're having repro problems, we kind of look for that. Again, the only problem with this is there's no commercially made vaccine. They're all autogenous vaccines right now to be able to use that. So it's pretty rare. We don't find it a lot. We do, whenever we're testing, we do kind of look for it whenever there's repro problems or slow starting pigs or anything like that. Okay, so want to talk about some bacteria here that can go systemic. These 3, so Strep suis, Parasuis, and Mycohyarinus. Mycohyarinus we talked about earlier. All 3 of these can cause the exact same lesions. They can cause this, you can see in here around the heart, this fibrin, cottage cheese looking stuff. Right here on the lung, the lining of the lung, you can see white. And then that's actually the liver. That liver should be bright red. It's actually covered in fibrin, which is what the bacteria grows to protect itself from the body. And so that is why sometimes no matter when we treat pigs or no matter what we do, those pigs will just continue to thump, is because that is just consolidated around their lungs and their organs, and they just don't thrive. It can be in and around their intestines, and so pigs may recover, but they're really slow growing. It's because those intestines aren't functioning properly to be able to move the feed through the gut and to be able to absorb nutrients. So again, that's why sometimes it's really hard, but without testing, it's very hard. I can guess and most of the time be right, but without actually doing testing, it's very hard to determine what is which one that we're seeing on those. So a little more specific on strep vaccines. So I get a lot of people that call me saying I'm seeing swollen joints in the Fahrenhouse, or right after I nurse them, I see the pigs that are down paddling on their side because strep went to the brain. And most of the time, pigs that are down paddling, it is strep. It's the one that can really cross into the brain really easily. The problem with that is the only way a strep vaccine is effective, and again, the only ones on the market are autogenous that are being made from specific isolates, is they have to match almost 100%. And so there's like, I don't know how many more serotypes of strep there are. I know at least 16. But like if my strep vaccine has a strep 1/2, a 3, and a 5, but you have a 7, vaccinating for that strep's not going to not do any good for your pigs. So that's when we've got to sacrifice a pig, get tissues, find what strep it is, and then we can see if there's a vaccine available that we can use some non-adjacent paperwork to be able to use that vaccine, or custom built your own vaccine if it's a very consistent problem to vaccinate your sows, but also vaccinating the pigs. So again, very important. Strep has to match to be able for it to be effective. Some different control strategies that we do. We've moved to try to, if we see strep fairly consistently, we can try to use a ceftiofur pre-farrow, either XNL or Naxel, 24 to 72 hours pre-farrow. Most of the time when pigs get contaminated with strep is the sow is carrying that strep in the birth canal. And so when those pigs are born, it gets in orally or in their nasal passage and gets to their tonsils. And it'll just sit on those tonsils until there's a stress event to really set it off. And so if we're able to give that antibiotic pre-farrow, then we can kill off that strep in the birth canal and really decrease the amount of strep that's in the population. You can also run some oral antibiotics, amoxicillin, Equisol. Both those are pretty effective on strep, like in the Farrenhouse pre-farrow, if it's easier to do that way. Other antibiotics are very good: Exceed, penicillin, Batril. Those all have very good strep coverage. One thing to know, Draxxin, which covers a lot of different bacteria, does 0 for strep. It is the one bacteria that causes systemic, those kind of, other than some enterics, that Draxxin will not cover strep suis. It does do good on Parasuis and Mycohyarinus, the two other bacteria that can cause some of these clinical signs, but does not do good on strep. Haemophilus parasuis, we mentioned earlier. So this is our third bug that can cause that fibrin, that bacteria that sits in around the lungs and the heart. Can also get back in the intestines and that. There is a very, very good modified live vaccine for this available. The one thing you've got to do, because it is modified live, is they can't have any antibiotics within 48 hours, both sides. Of giving this. So a lot of time we'll give this in the Farrenhouse pre-weaning sometime, why they don't have any antibiotics on board, or it's been a few days since they've had their shot of Exceed or a shot of Draxxin or something like that. But it does work very, very well. So again, we've got to watch our antibiotic placement with that. But that modified live, it's called Parasail. It's a very, very good product. There is also a killed vaccine, Parashield, that we use a lot. It has to match a little bit better than what Parasail does, because Parasail is a modified live, so it doesn't have to match, because there are some different serotypes with Parasuis. But if it's hard to control antibiotics and when you're going to time this, the Parashield is easier to use. Okay, jump into enteric. That'll be our last category. Lots of different enteric things we'll see. We'll see anything from bloody stool with some acute things. That's a salmonella that's got some mucus in it and stuff, or just classic watery diarrhea. So sometimes we'll see where it's low morbidity, which means you don't see a lot of it within a population. Causes disease, feed ration change. I see a lot of nurture. I get calls, hey, my pigs are loose. Well, they just made a feed ration change, and so that pig's gut is getting used to that change. Or a very strong antibiotic, and so we're treating for pneumonia, but we give a very strong antibiotic. Well, also that antibiotic kills off some of the good gut bugs, and so they get loose a few days because of that. I'll see it just in weather changes, whether it just is the stress on the body will make them loose for like 24 hours. I just got a phone call 4 days ago. They walked in the barn. They've got a set of boars on feed, and they all had diarrhea that morning. Well, within 24 hours, they were all dry again, and all our testing's been completely negative. So we're blaming that on either, was it a bag of feed that was a little different within that, with the feed, or maybe a weather change. Again, low morbidity, just they're scouring or they're loose, they got diarrhea, so we lose some days on feed. Or it can be high morbidity, which means it affects a big percentage of population, or high mortality. And so that was like a salmonella break that we had in a finishing barn. They walked in. Salmonella produces a lot of toxins really fast when it grows in the gut. So we'll see those clinical signs. So enteric diseases can be very broad on what we see. Prior to diseases, or prior to VFDs, every show feed you'd buy, whether it was Showtech or Lidner or no matter what feed across, Showright, it didn't matter. They all had either 100 grams of Linco in them or they had Thailand in them. The nice thing about that is those controlled ileitis and mycoplasma. So ileitis is a gut bug. It causes thickening of the intestinal wall. So you see decreased performance, you see looseness of stool, or the mycoplasma in the lung, or all the mycoplasmas that we talked about earlier. So both those drugs cover those very well. And so the next year after we lost, when VFDs came into place and all feeds, except for like Denigard and BMD, needed VFDs, that next year, like our Indiana State Fair, the pigs were all 20 pounds lighter than what they were the previous year across the board, just because the animals didn't perform as good, their guts weren't as clean, they just had more challenges, and so their performance just wasn't as good. Which was the goal of putting VFDs in place, is they don't want antibiotics and feeds just for performance. They want us to strategically use them in the right places when disease is happening. So ileitis, Lawsonia intracellularis, there's two different versions. Acute, which is, so this is like a normal intestine, or not a normal intestine. This is an intestine with ileitis, and so it's very thickened, where the small intestine, you should almost be able to see through it. That is an extreme case of ileitis, or you'll kind of see loose stools like that, sometimes with blood in it. But again, there's two different, there's the acute version, which is you walk in and the pig has extreme diarrhea, it's dark, it's bloody, they're pale looking because it's so severe and hit them so fast they're bleeding into their intestine, and mortality can happen within 24 hours if not treated properly. We see that a lot for some reason in replacement gilts that are back or they're just getting ready to start. That's the most common phone calls I've got. They're getting ready to breed them. That's the most common time that we do see it. They quit using some antibiotics through the water. The gilts are kind of on their own. We see that a lot. Chronic is just a slower onset. They've got some loose stools. We won't see death loss. They lose their bloom. They lose some average daily gain. We'll talk about a vaccine on this here in just a little bit. Okay, right here. Ileitis control strategy. So we'll see here in a little bit on a purchase pig protocol, we talk about vaccinating there's a very, very good, actually there's no one coming on the market here in about 30 days. Two different injectable ileitis vaccines that work very, very good. So we're tying that into. A lot of the commercial industry is also using water, but again, it's a live vaccine, so you got to have no antibiotics in place. It's got to run through a medicator. A lot of us don't have enough pigs in the barn to stimulate the medicator good enough, or a lot of these come in like the water vaccines come in 100-dose bottles or 500-dose bottles for like commercial barns. So it's just not very feasible to do where the injectable good. Antibiotics that do work very good, and so like my go-to on one with acute ileitis is Thailand, very aggressively and very quickly for a few days in a row. But you can also run Thymulin, which is your Denigards and your generic like Tiagard and that stuff through the water, also Linco. So those are the three drugs that work on ileitis very well. E. coli, we can see E. coli a few different places. One, we can see it in the Farrenhouse. So it's that baby pig scour that hits them very, very quickly after they're born. To be able to control that, we will use baby pig scours and feed back 4 or 5 weeks prior to farrowing. What we do is we expose those sows, they build immunity to it, and then E. coli is in antibodies are in the colostrum, and so that helps protect the baby pigs, but also vaccines pre-farrow. So like a lot of PillaShield, LitterGuard, those type of things. That's why we use that, is because it's got different E. coli's in it, different Clostridiums, to be able to boost up the immunity to put those antibodies into the colostrum. Nursery, this is where we really run into a lot, especially I get a lot of phone calls on this. These pigs come off feed. The show industry, we feed these pigs a lot of high protein, a lot of high energy to get them going on feed, get them blooming as fast as we can to make them look right to be able to sell them. Well, when we do that and there's some E. coli challenges, we also feed that E. coli. And so the commercial industry over the last few years has started dropping the amount of protein that they're using in those nursery diets. They're actually feeding lower proteins not to feed that E. coli, keep that gut right, and prevent those E. coli breaks. Because hemolytic E. coli can cause very high death loss very fast, and it's very hard to treat and get under control before causing 10, 20% death loss in a nursery. So there are some different vaccine strategies with this. They're a little harder. You got to get them placed right because they're kind of competition vaccines, and so we'd run it through. What it does is it's a low virulent E. coli. We run it through the medicator. All those pigs or orally dose every pig, and that E. coli actually goes into the gut and grows and adheres itself to the wall of the intestine, but it's non-toxic E. coli's. And so the bad E. coli can't attach to the wall because there's already one there blocking the receptors. And so the bad E. coli then just passes right out through the gut and can't cause any disease. Rotavirus, real quick on our BAC-T versus viral challenges. So E. coli's, Clostridiums, the bacterial causes, what they do is they adhere to the gut wall, and they activate the pumps in the intestinal wall. And so it's called a secretion diarrhea, where the body is actually pumping fluid into the gut, and then it goes out. And so that's what causes the diarrhea. And so it dehydrates those pigs really, really fast because it's pumping fluid out of the body. Where viruses, rotavirus, PD, TG, Delta Corona, now sapovirus, they go into the villi of the intestine, and actually the villi is what is like little fingers that stick into the gut off the intestinal wall, and they absorb water into the body. So this is a non-absorptive diarrhea because it kills off those villi. So some of them will be more severe. Rota, so if you've got a villi like this, rota will knock off just the end of it. PD knocks almost the entire thing. So that's why PD is so deadly, especially in the Fahrenhaus, because they're not absorbing any fluid into the body except for with very extreme electrolytes. And it's called non-absorption diarrhea. So the water, whatever fluid they take in, goes right out the back, and it never even makes its way into the body. Again, feedback works really good for rotavirus and some of those things to really stimulate immunity. The difference between the immunity of the virals and the bacterial protection is all in the colostrum that they get day one. All the viral ones the pig gets that immunity every day they nurse, and so it's in the milk every day, and so it coats the lining of the intestine and prevents the virus from being able to attach, and so that's kind of the difference between those. PD, Delta Corona, and TG, very, very similar. You've got to do testing to prevent. We hardly ever see, back in the day when I was little, TG was everywhere. Every 2 or 3 years, there'd be a major TG break. Well, ever since PD and Delta Corona got here, TG's kind of, it's completely disappeared. A lot of different ideas on why, but TG we just don't see anymore. Now it's PD and Delta Corona. This is very extreme vomiting in the Fahrenhaus without the right things, or weaning early can be almost 100% mortality. All that. Keep going. Okay, so kind of got done through some of the disease processes. This is a very general SAL vaccine protocol that we use. We can dive into a lot more things, very far specific, but this is a very common one. So pre-breed gilts and sows, your parvo lepto erysipelas, which is your Farashire Golds, your Parvo Shields vaccines. We want to do that 2 to 3 weeks pre-breeding. We want to get that one. We don't want it close enough to when we breed them, so we're stressing the sow. This is semen's expensive. We don't want to do anything that's going to stress that sow right before you breed her and have any kind of immunity build and everything like that, because we want every chance possible to get her bred. So we do it at least 2 to 3 weeks before. Gilts, we do want to try to get 2 doses in them because they've never been vaccinated before. The sows hopefully have all had it before, so 1 dose is enough to boost that immunity back up. Gilts, we do want to try to get 2 doses. Circomyco, like I talked about earlier, we want to do that pre-breeding as well. Mycoplasma, the goal of that is to build immunity in that sow so she doesn't shed any mycoplasma. Most of the time, pigs get exposed to mycoplasma in the farrowing crate if the sow's carrying it, so vaccinating her prior to that. Influenza, it's just good to be able to keep that sow herd boosted a couple times a year, which is your flu. PRRS, again, we want to do that ideally pre-breed, but sometimes because a lot of people are farrowing more year-round now, just because of the way the show industry's changed and their shows year-round, we try to do most of the sow herd pre-breed, but sometimes we got to do them while we're bred, and we really don't see much problems with that. Pre-farrow vaccines, so actually when the sow's bred, the scour vaccines, we want to do those, depending on whether we're using bacterial or viral. The bacterial, earlier the better. 5, 3 weeks, 6 and 3 weeks, 6 and 4 weeks pre-farrow is the best because we're building immunity in the colostrum. Viral ones we can do, so our rotovaccines, those type of things we can do a little closer because those are building immunity while they're lactating and continuing to shed those antibodies through the milk. It's called a suckling immunity. This is where we talked about boostering with Pastorella and Bordetella just to make sure those sows aren't carrying any Pastorella. And then really important to do some Ivomec or Dectomax or some kind of dewormer. We'll try to get into that a little more specific here in a little bit. But something to clean up the mange that sow might be carrying before going in the crate. Because if she goes in the crate with mange, then she's just going to give it to all her baby pigs, and you're just going to start yourself with a problem. Pig vaccine, again, very, very general. At birth, within 24 hours of birth, we want with iron. We typically use iron 100 milligram, or you can use 200. But the goal is to be able to do it twice. And I'll talk about that in a minute. But less than 24 hours of age, we want that antibiotic in under 24 hours of age because that will prevent more umbilical hernias. So most of the time, if you wait to 3-4 days of age to be able to give your iron or even your antibiotic that's good on protecting that, yeah, you may not see your navel cord abscesses or belly buttons or issues when they're nurturing or in the farrowing house or even at weaning. But that bacteria grows so fast when it gets up the umbilical cord that first 24, 48 hours that it can cause damage that's already there. Yeah, we gave the Exceed or Xanella or penicillin at that 4 days old, so it killed off all that bacteria so you don't see the abscess, but it's already done that damage to the belly wall, and that's the pigs when they're 40, 50, 60 pounds that'll start get that umbilical hernia. And start to get that hernia that's sticking down, even though there was no abscess, but the damage was done within 24 hours of birth. So we do that. Again, we'll repeat that typically at 7 to 10 days of age. And again, this is all veterinary specific on what you're dealing with your herd, on what antibiotic is necessary, or if it's even needed again. You may be able to just do it now and be done. A lot of people will just use 1 dose of 200 milligram iron within a few days of birth. The problem with that, and there's multiple studies out there, even by the iron companies that make these irons, is that 1 dose of 200 is not enough because those baby pigs cannot take all that iron up when they're that young. And so we're wasting about half that iron anyways. And a high percentage of that, even though they don't look pale at weaning, will have subclinical anemia. And then that subclinical anemia opens them up to get sick easier. They won't wean as good. Then you start seeing them pale in the nursery. And so it's either better to do 100 twice, where we're getting them boosted, or even 100 and 200 or 200 and 200. But 1 dose of 200 is not good enough for most sets of pigs. We can kind of use our Pastorella Bordetella vaccine at this time. We can also place our Paracel vaccines at that time if needed. There's lots of different things we can kind of do at that 7-10 days window, farm dependent. Weaning through nursery. Most farms, if they're PRRS stable, this is when we place their first PRRS vaccine. This is when we'd give their first round of Circomyco vaccine. We'll give them Ivomec, Dectomax to try to clean them up coming off the sow. Sometime in the nursery, they need a flu erysipelas vaccine. Those diseases we more see later in life. so I'm not as important as getting those right off the bat. They can be kind of anytime in that nursery stage and be fine whenever be getting placed. Very important, I think, to booster. These are Circle Myco options, almost all of them. You can either give one full dose at weaning, or you can do a split dose, one at weaning, 1, 2 to 3, 4 weeks later. That will get your highest immune response by splitting those vaccines and also push your immunity later out in life. We'll go ahead and talk about that a little bit. So our show pig industry used to be our pigs 5.5, 6 months old when we show them. Well, that's not the case anymore. Now they're 8, 9, 10, 11 months old. Time to show them, and all these vaccines that we use were built for the commercial industry, and so all those commercial pigs go to the slaughter within 5.5 months. And so that's as long as those vaccines need to last to be able to protect those pigs that are going to market. And so it's very important, and I'll talk about in a little bit, the farther out we stick that second Circle Myco, or even when you buy your pigs to booster some of these vaccines, that'll help protect those pigs later on out as you continue to show them before you really start hitting your jackpots and that kind of stuff. Purchase pig protocol, so coming in, lots of travel, they're getting commingled, they're going long trips on trailers, some kind of electrolyte just when they come in to get them started good. Depending on the situation, sometimes an antibiotic is very important just to get them, to just protect them from the stress of travel and all that kind of stuff. If they were at a pig sale with multiple different pigs, to protect them, get them cleaned up from anything they may have got exposed to there. Vitamin B complex is very good for appetite, just make them feel good too. And so those things coming right in. Sometimes if they're really a little slow, come off the trailer, a small dose of dexamethasone just to booster their appetite, get them started on feed. But then we'll start pushing like this boostering of Circle Myco right away, just to make sure, because that is an earlier vaccine, we need to get in them earlier, just to make sure that all your pigs have been vaccinated, because some producers are better at vaccinating than others. And then depending on PRRS, what the situation is there, using a modified live, because like I talked about earlier, some pigs are coming out of farms that are very, very clean, that have never seen PRRS. Some pigs are coming out of dirtier farms that have already seen PRRS. And so hitting an entire set of pigs with a modified live will booster that immunity to help prevent that viral shedding across the population in your barn. Later, flu vaccine, prior, a few weeks, months before starting your jackpot shows. Again, it's not only to help your pigs get through a show, if they do get exposed to the flu, get through it faster, but also flu is one of our public health concerns, because we've seen earlier it does move to people. It is actually easier for people to give it to pigs. There's a lot of our flu breaks I see in commercial pig barns that I'm pretty sure it came from one of the workers that was sick, had flu, they went to work anyways, and so then they broke that finishing barn. It is easier for people to give to pigs, but it is very, very easy also for pigs to give it to people. Ileitis vaccine, what we talked about earlier, and so there is 2 different injectable ileitis vaccines, just to make sure that you've got high immunity to ileitis to prevent. Last thing you want to do is go to all this work, all this expense on buying these pigs, all the feed that we put into them, and then have an ileitis problem where those pigs aren't as blue to me, or they don't respond to your feed or your supplements as good as you want to. Deworming protocol, a little difference there. Your Ivomec and Dectomax, cc per 75 pound. Those get a lot of internal worms, but also get your external parasites like your mange and your lice. Where Safeguard and your fenbendazoles only get internal parasites, but they will get some internal parasites that Safeguard or Ivomec and Dectomax won't get. And so it's good to kind of rotate those, especially what you're seeing. Now, if your barn's completely clean, you don't see any of the red bumps on the chest, no mange signs at all, no itching, then you can just stick to your Safeguard program, because that is by far the superior internal parasite program to be able to get most of those internal parasites. Again, we don't want them to be full of worms or have issues when we've done all this work to try to get that pig the best that he can. One program that I will use, I'll talk about on external parasites. There's a lot of failure. A lot of people report that they don't have good mange control. It's very hard to get mange under control. So the very best program on external parasites for mange and lice. We don't see lice very much in show pigs, but we do find them sometimes. It's mostly mange. Is day 1, either Ivomec and Dectomax and soak with prolate. It's very important to use prolate, is to actually cover the areas where you see the mange. You've got to get underneath them, spray their chest, spray their flank, and get all that. Day 5 to 6, spray Prolate again. And then day 12, do both of them again, Ivomec or Dectomax and Prolate again. Because of the life cycle on mange, if we only do that one time, Ivomec and Dectomax won't kill the eggs, and then they'll hatch. And if we do it again at 12 days, we can kill all those before they start laying more eggs, and so we can break up that life cycle. Okay, very quickly we'll go through some phone calls and we'll wrap this up. Red eyes. So this is the guy. I get phone calls, and we've seen a picture earlier with the mycoplasma. The eyes are very full. They've got conjunctivitis. That red third eyelid is, it's like us when we get allergies. Our eyes get really itchy. That kind of swells there in the corner. It's the exact same thing. It can be from allergies, but also it can be from viral components like PRRS. It can be bacterial causes, chlamydia, mycoplasma hyarinus. Lots of different things, like we talked about right there. Definitely more prominent in particular farms. I think it has gotten a little better over the last couple of years. Treatment. The problem is there's a lot of different causes, and so we've kind of got to try on what antibiotic works the best, different eye ointments, different injectable to try to treat it internal out. Because mycoplasma hyarinus we find a lot, we will use something that is good on mycoplasma, like injectable Linco, Draxin, one of those. And then we will also use some kind of oral treatment to treat it topically as well. So I have started putting in case it's allergic, we have started using some injectable that recover that antihistamine that we used earlier. But a lot of times I find just washing that pig daily and really scrubbing their eyes and getting their eyes clean and keeping all that junk out, they will recover over time. Sometimes it just takes longer than we want. Gland swelling, this is definitely something that's way improved in the last 3 or 4 years compared. We don't get near as many phone calls. Maybe partly people have learned how to manage it a little better, because a lot of it isn't treating, it's managing those pigs once they get it. Because even though the lymph nodes, it is definitely their lymph node that is reactive, because we've took out lymph nodes before and sent them off. And under histology, those lymph nodes are reacting to something. And so whether it is a virus, whether it is a bacteria, whether it's a feed ingredient, because we definitely know that there's certain topical feeds that we use, supplements we use, that definitely will make them worse. Wet feeding will definitely make slopping to pigs when you wet feed will definitely make it worse, because we get more hydration in them and it causes more swelling. But something is stimulating that lymph node, and so just help managing it. We will give an antibiotic just in case it's bacterial, but again, it's just an everyday kind of thing of managing your feed and what supplements you're using to be able to manage that. And what works on one pig will not work on another one. Common phone call is cracked back. People, internet, call it dippity pig. I think they call it dippity pig because they're so sore and so cracked that they dip their back and drop down because it's so painful. Kind of looks like they act when they get a sunburn. What causes it? No one 100% knows. Now, when we swab their backs, we will find staph, like we do find in greasy pig cases. But why it happens? But staph is also a normal commensal of pig skin, so we find it because it's normally on the skin or not. What's very, very interesting is a lot of the times it's horizontally across their back, perfectly spaced apart. And also it seems to be in line with the vertebrae. And so is it where particular blood flowing's through or whatever? There's times I see incidents where I think it's an environmental change, like there's a big weather change, or it's the first time we got the pigs out in the sun or washed them and used a certain conditioner. But there's also times it's the first time we tan them. And I know we didn't burn them, but is it something, a pH change of the skin? No one's really proved exactly what it is, but we've found some very, very good ways to treat it. Again, like some of the other things, the faster you can get on this, the faster you see it, and the faster you treat it, the better. If I walk into a barn and one of the kids' pigs are starting to break, we'll immediately dry it with a towel and get all the fluid off we can. And then we'll give them an injectable antibiotic, Exceed, probably because it's long-acting and it's the most really broad coverage on different bacteria. And then we'll also we'll soak it in Vetricin VF. And if we do that fast enough by drying it, give them an antibiotic, maybe even a little dexamethasone, and get that Vetricin on it, we can stop it almost every single time. And by the next day, they're very, very good. There's a new product that we're using called Helicin. That is more, we'll do the Vetricin, let it dry, and then we'll soak it in the Helicin. That Helicin product, creates a barrier on it. And since we've started doing that protocol, I know there's a lot of people that use mayonnaise, they'll use squirt penicillin on it and do all those kinds of things. I think there's some inconsistencies on there. That program, we have been very, very successful. But again, you can't wait till it's oozed and it's crusted and all that. You've got to get on top of it very, very fast. Parasites, so again, just very quickly, so why parasites are more than just causes pigs not to perform as fast, be unthrifty, but also you can see, so the interesting thing about roundworms is roundworms, they get ingested, they ingest them, they get into the gut. Those larvae will actually hatch. They'll crawl through the intestinal and get into the liver. And then those are actual milk spots where parasites have gone through the liver and then gets in the bloodstream and goes to the lung. And then they get into the lung, and then pigs will cough because they cough up that larva and then swallow them again. And so the roundworms do an entire life cycle. They're not just in the gut. They can cause damage throughout the entire body. So important to be able to keep that. So a regular deworming protocol to prevent those problems. Again, sows, we kind of talked about that earlier. Roundworms, we just got done talking about that. Whipworms we don't see very often because most of the time they live in the dirt, but this is one of the parasites that Ivermectin Dectomax does not get, but Safeguard does do. But again, we'll see this more only, and it's more routinely, like you'll always have problems because they live in the dirt and then the pigs, but most of the time pigs inside we don't ever hardly see this. External parasites, mange, the red bumps on the chest, raised bumps, they very, very, very itchy. And again, most of the time, for whatever reason, whether it's the skin softer down there and it's easier for the parasites to live, or the animals can't itch as good there, so that's where they naturally migrate. But they're typically on the chest and back in the flank and on the insides of the legs. We talked about that treatment. Lice, you can actually see the lice. Again, we don't see very much of that. Mange control, okay, there's that program that I talked about earlier to be able to have, to be able to really get a good, effective treatment on mange. Okay, that's what I've got. Do we have any questions here? Yes, so there's my email or the office. So we have some standardized protocols that we can email you and send. All you've got to do, probably better to call that phone number versus email me. But the 765-468-6099 will get you directly to our office. And one of the ladies there in the office can then send you a protocol. And so we do have some protocols that are more standard for people that we do not have VCPRs with, but then if you do have a VCPR with us, we can build you a more specific protocol depending on what issues that you have currently at your farm. So again, I thank Russell and the Alton Water crew for having me here today. And again, if you got any questions, feel free to call our office. Thank you.